Hello, everyone. Today we will talk about hydrolyzed collagen supplementation. Are these important? Are these relevant? Do we have enough clinical data and in vitro data to support the benefits that these supplements claim to have? So without further ado, let's start with our presentation. So there is no doubt that hydrolyzed collagen or collagen supplementation is on the rise. People really want this. They think that they provide a lot of benefits, and it has been estimated that the market for the U.S. market for this will be increasing in about 10% between the years the 2023 and 2030 year and 2030, and that like the industry was about $9.1 billion into 2022. So a high demand for this hydrolyzed collagen supplementation, which tell you the market. The people are very interested, but let's see what the science says. So what is the rationale behind this supplementation? So the first point that comes across is like collagen is the most important or the most abundant protein in the body. It's important to remember that when we talk about collagen, we're not talking about collagen 1 or 3, which are the most abundant in the skin, as well as collagen 4. We are talking about an umbrella of proteins that are, like over 10 different type of collagens that are, part of this, like a statement. So when we say collagen is the most abundant protein in the body, what we are saying is like this family of collagens, this different type of collagens, basically when you group all of them together, they are the most important or the most abundant protein in the body. The other thing, and I want you to take this next statement with a pinch of salt because it's a little bit misleading to me. It's like, it's important. So we have collagen, basically the most abundant protein in the body, and we lose about 1% of our collagen in our body by the age of 30. And by the age of 40, we start losing 1% of collagen per year. These are very impactful statements, and probably if you read it, you panic, you say, I need more collagen, I'm losing collagen like crazy. If you do the math, when we are 90, if this is happening, 1% of collagen per year, we will be blobs. We will have no structure because collagen is a structural protein. So I think although this statement can be scientifically true, are misleading because it implies that you lose collagen and you don't have the capacity to restore that collagen. And for example, in the case of the skin, you lose collagen 1, but it's replaced by collagen 3. So kind of like, like you lose quality of collagen, but the amount of collagen can be very similar or like, not as dramatically reduced as when you do the math for this statement. Okay, so what are the potential benefits? Why people want this hydrolyzed collagen so much? So the marketing claims that are linked to this are skin health, of course, anti-aging, wound healing, repair. But the question is like, are these claims clinically proven? We will see. We will analyze some of the published data in peer-reviewed communication to see if these claims are correct. So let's take a deep dive into collagen. To understand how collagen works, how hydrolyzed collagen can provide benefits, we need to know about how collagen, which is a protein, is digested, how collagen is produced, what the supplement can provide us, and analyze, as I say, the scientific literature. So let's start with how proteins are absorbed. When you eat protein, either a steak or you take your collagen supplements, proteins will be digested into small units. So think about a protein as a Lego structure, where the full Lego cannot be absorbed by your guts. So you need to deassemble this structure. Usually protein is highly complex. They have three-dimensional structure. So you need to deassemble this to the single units or to 2 or 3 units. So the protein must be digested into 3 peptides, which means 3 amino acids, dipeptides, or 2 amino acid or single amino acid to be absorbed. So this is a major digestion. Think about collagen. Collagen is this huge, protein that need to be basically broken into pieces. The absorption doesn't happen in the stomach where it's digested. The absorption happens actually in the small intestine. And the absorption is like due to a process that is called facilitated diffusion or active transport. So our body really wants those tripeptide, dipeptide, and amino acids, because basically with that, with those Lego units, we can build whatever we need. The absorption rate of a protein is about 90–95%. So extremely efficient process that basically will make sure that everything that was forming that protein, most of the things that were forming that protein will be absorbed, will be recycled, and we will use it in our body to produce new protein. So what happened after these, peptides are absorbed? So we have, like our tripeptide, dipeptide, and single amino acid, they go into the bloodstream and they go straight to the liver. Remember, the guts are connected to the liver by a bloodstream system that is very efficacious. Everything goes to the liver first, and the liver clean that blood, because always you have some passage of bacteria. So the liver clean that blood and send it to the rest of the body. But it is important to remember that the liver basically is the organ that uses amino acids the most. It's the one that produces most of the protein. So liver takes first pick. So whatever of these 95% of these amino acids that were absorbed when you digest the protein, liver will basically take them first and figure out what to do, what is needed. The excess of amino acid, tripeptide or dipeptide that were absorbed, can be converted into fat or glucose. There is a very cool process that allows you to do that, or can be sent to other organs that they need those for, like repair, or and the main sources, the main organs that get this, basically amino acids are bone, joint, and skin. So as you see, it's not that 95% of the amino acid that we absorb goes straight to your skin. They need to pass through a process, and liver is very, very, greedy about amino acids. So the amount that gets available for the skin are not that much. Okay, so what do we need for collagen production? So we know that we can digest, we can have hydrolyzed collagen, and we can, digest proteins or digest your steak that will be absorbed. Your liver will take first pick, and after that you will have a structure, basically these unit Legos to form collagen. So what we need for collagen production, we need lysine, glycine, proline, and proline can be converted into hydroxyproline in the body. So from all of this, the only essential amino acid is lysine. What this means, essential amino acid means that our bodies are unable to produce. We need to eat lysine. We need to get them from the food because our body is unable to produce it. On the other hand, like the other amino acids like glycine and proline basically are non-essential. So that means that we can produce it. And as I said, proline can be transformed into hydroxyproline if they need it. So we need, this amino acid to produce collagen. So the rationale behind, taking hydrolyzed collagen supplementation instead of eating a steak as a booster of collagen in your skin is related with the fact that when you take hydrolyzed collagen, which is a collagen that has been digested, you are getting mainly these amino acids. So you are from all the Legos in the world that you can get, you are getting the Legos that you can form your, your collagen in the skin. That is the reason why people start, looking into collagen, hydrolyzed collagen as a supplementation. So it is important to highlight that although lysine is about 3 to 4% of the total collagen, the total amino acid that form collagen, it's fundamental for cross-linking. So if you don't have lysine, your collagen will not be cross-linked, will not be packed correctly. And when it's not packed correctly, you have, like a low quality collagen. And this is observing some, genetic disease that you have, like an issue with the absorption of lysine. And basically you cannot form a high quality collagen. So although, only 3% of the amino acid in collagens are this essential amino acid called lysine, is very critical for high quality collagen. Okay, so what do we need? So we have the skin, we have all these amino acids that can reach the skin. What do we need? We need a fibroblast, of course, the amino acid. We need enzyme because we will see the process of producing collagen is highly complex. We need vitamin C. That is the reason why people are so obsessed with vitamin C, because produces the hydroxylation and the packing of collagen. We need copper to produce the maturation of collagen, because collagen is produced as an immature protein that matures outside of the cell. So as you see, it's a long list of things that need to happen for you to have collagen. So just eating your hydrolyzed collagen, just taking your hydrolyzed collagen supplement is not enough to produce collagen. You have to have this. And when it comes to vitamin C, you can apply it to the skin. I don't apply vitamin C to my skin because of the acidic pH. I really don't like it. My skin doesn't respond very well to that, but I do take supplementation of vitamin C every day to make sure that I have enough vitamin C in my body for not only the immune system, but also for the skin. Okay, so collagen maturation. This happens outside of the cell. So remember, collagen is a highly packed, huge protein. So if you produce this inside of the cell, it's like the cell will burst, basically. You will need to have a gate to export this highly complex protein so big that probably, will disrupt the cells. So the cells are really clever. So what they do, they have, the synthesis, basically the production of the line of amino acid done inside of the cells, a couple of glycosylations, a couple of, formation of procollagen, so that you have 3 lines of amino acid basically forming an helix. And this basically is small enough and big enough to be exported outside of the cell. When this outside of the cell, you have basically the maturation of collagen that is linked to cross-linking. So collagen is a highly packed protein. If you take, a bunch of spaghetti and you put it together and you put a rubber band around them, that is how collagen looks. So highly packed structure because it's a structural protein. So you have processes that happen inside the cell and outside the cell. So far, very, very complex process. So one thing that we need to, we can all agree right now, based on what I just say, is collagen fibers cannot be repaired. Because imagine you have this spaghetti all packed together and you damage one side. How you will put a piece that is exactly the same length and glue it that? So it's impossible to be repaired. And that creates, a level of complexity, because although they are highly packed and they're very stable and they can defend themselves, from damage, once that you significantly damage mature collagen fiber, you need to basically cut it. Basically, it's digested to single Lego units, and you can send it back to the cell, and basically the cells can reuse those amino acids. But it's important to remember collagen, it cannot be repaired. It needs to be basically, at least when we talk about collagen 1 and 3, it needs to be basically degraded, removed, and destroyed, and replaced. Okay. So let's talk right now that we are expert in collagen synthesis. Let's talk about collagen supplements. The definition is external collagen that you ingest. So it could be hydrolyzed collagen, full collagen, or whatever form of collagen. The main source of collagen is agro-food waste. So bones, tendon, cartilage, teeth, and skin from cattle, chicken, and fish. This is what we call the marine collagen. And it's important to remember collagen is not vegan. Collagen is a protein that is intrinsically linked to animals. So if you're looking for a vegan supplement, collagen is not the one that you should take it. There are some companies that are trying to produce collagen peptides right now in the lab, which are cruelty-free, but so far it's extremely expensive. So we will see that we need to take a couple of grams of hydrolyzed collagen to see potential benefits in our skin, at least. But, with the cost of this lab-made collagens, it's very expensive. So it will be super expensive to do that. I will suggest to go and eat a nice skin instead of paying for that price. Okay. So what is the difference between collagen versus collagen peptide and hydrolyzed collagen? Collagen peptides supplements, they have the same amino acid composition of collagen, so all those amino acids that we talk about, and it must be broken into tripeptide, dipeptide, and amino acid when they are absorbed. So it's kind of a kind of large peptides, like pieces of the collagen that needs to be digested. Hydrolyzed collagen supplement, they have the same composition of collagen, so again, but they are already broken into tripeptide, dipeptide, and amino acid, which makes easy to absorb. This makes the claim of more bioavailability for collagen, I'm not sure, to be honest, because if you have a system, a gut system, a digestion system that is working pretty well, collagen peptide will be able to be digest to this. It's not that it will take higher time. It's basically, like a nonsense to me. Now, if you have issues, like one of the things to consider here will be if you are under a proton pump inhibitor like omeprazole or esomeprazole. Those things can affect the digestion of protein because they decrease the basically acidity of the stomach. So maybe, like that is a case which you should use hydrolyzed collagen. The prices between the two of these are very significant. So collagen peptide being cheaper than hydrolyzed collagen. Okay, so remember when I told you about that claim that say like if we lose 1% of collagen after 40, we will be blobs? Well, this is something that I took from a website that is promoting a collagen supplementation because it's something that I see a lot. So this plot basically is showing you that, like after 40, you have 60% of the collagen. This is in the, they don't say in the skin or anything, but they are supporting skin benefits. And after that, you continue, decreasing 1%, 1%, 1%. And when you are 80, you have 20% of your collagen. This is impossible. This is like mathematically impossible. You cannot have 20% of your collagen. So yes, maybe the collagen, gets accelerated. Maybe the quality of the collagen decrease. But this is something that is what I call the scare tactics of marketing to basically make you believe that you will end without collagen. What happens if you live to 90 or 100? You will have no collagen according with this plot. So this is basically a math that was done by marketing using a scientific statement. Okay, so let's look into a couple of like peer review communication. And I want to say that most of the time when I look at this, I highlight things that I don't like of the product design of the conclusion, but they're all good papers. And they're all, like products that at least took the risk of doing a clinical study, which tends to be extremely expensive, to back up to support their claims. So the first, peer review communication, it's a double-blind placebo-controlled study. So double-blind means that the subject don't know what they're taking, neither the people that are giving the samples to them. 46 women, ages 45 to 59. This is related with skin improvements. And they have no cosmetics product before 2 weeks. The 2 weeks of the study, except for sunscreen. I have a big issue with this because if you stop using your moisturizer, your antioxidant, your retinoids for 2 weeks before the study, your skin will decrease in quality and will get, like, for example, like I live in Colorado, it's extremely dry. You stop using moisturizer, your skin will be super dry. So when you go to the study under this, washout periods of ingredients, you will see a huge increase in skin quality by nothing, because just putting Vaseline after 2 weeks of putting no skincare products on your skin will produce a huge benefit. So from the start, not liking this part of the study design. So they have 2 groups, one group that was placebo and then one group that was taking hydrolyzed fish cartilage, 500 milligrams once daily for 90 days. They don't disclose what is the skincare that they gave them after, like this period with only sunscreen, so I cannot comment on that. Okay, so what they observe, basically, they observe, this is, the pictures of the wrinkles, 90 days of taking this, you see an improvement. I really don't like when people do this magnification without adding the big picture, because I don't know, like what you are magnifying. I don't know, if this is when I see your face, if this is significant or not. So, but apparently there is a decrease in the numbers of wrinkles 3 months after taking the supplements. When you look at here to the wrinkle score, the nasolabial wrinkles decrease, huge standard deviation, which is like, and the same with the periorbital area. So the conclusion of this study is like the present study showed that clinical benefit for the skin obtained with oral supplementation with a low dose of collagen peptide from hydrolyzed fish cartilage. I will say, like a moisturizer will have the same effect. Probably a moisturizer with retinoids will have even better effect. So Is this worth to have the, adding the supplementation for this result? No, that is my opinion. There is another study that basically talk about collagen hydrolyzed collagen for skin protection. This is, basically taking the collagen orally, and this again a double-blind, randomized, placebo-controlled monocentric study with more patients, 122 men and women. So good, we're using both. And we have a group that is the placebo and a group that got the goal activate collagen. So I hate when, no, that was too strong. I strongly dislike when in peer review communication they use their marketing technique name, because the science became, like basically propaganda. So I don't like that. So anyhow, so when I look at the ingredients, in this goal active collagen that they were giving to these subjects, you see that they have soybeans. So soybeans are great for skincare. They have, an action similar to estrogen. And we know how our skin likes estrogen. They have vitamin C, they have vitamin E. So they have a lot of other things that can be contributed to the collagen, the benefits. So after 90 days, what they observed is a 40% increase in skin elasticity in comparison to the placebo, reduction of solar elastosis, and collagen fiber organization. So they claim that they remove this, supplement basically remove the elastotic material, and I have a better collagen quality. And subjects report more hydrated and more elastic skin. Usually more hydrated skin is perceived by subjects as more elastic. It doesn't mean that you have more elasticity. It means that your skin is more flexible. So as I say, very, encouraging results. Another peer review communication, again, double placebo, almost 70 patients. And these guys were getting, 2 doses of hydrolyzed collagen for 8 weeks, so only 2 months. And we will observe, again, improving skin elasticity in both treatment groups. So the one with low doses of hydrolyzed collagen and high doses of hydrolyzed collagen. Skin elasticity improvement was higher in older women. What a surprise, older people tend to have more damage. So whatever you do, you get better, results, because you are dealing with the bottom line is very low. And they saw no significant difference in skin moisture or transepidermal water loss, which surprised me, to be honest, because when I took collagen supplements, I always noticed an increase in skin hydration all over my body. My face is like well taken care with my products, but all over my body, I see an improvement in skin hydration. So another, peer review communication, in this case, 114 women, with a doses of 2.5 grams of this bioactive collagen peptide. And again, they use the fantasy name, the commercial names, and what they also observe in 2 months is a 20% reduction on eye wrinkles in comparison to placebo, and an increase in collagen type 1 and 65% and elastin. This is a small group of biopsy. This increase in collagen, it's super high to, to be, in 2 months, and maybe means that the level of damage of the subjects were really, really bad. But I will, unfortunately, I couldn't find in the paper more specification for this, but, it is what it is. These are the results of the peer review communication. What I want to point out is this supplement not only have hydrolyzed collagen, but has vitamin C, it has hyaluronic acid, and it has proteins. So remember, proteins can be digested to amino acid, and if you have lysine or proline, those can be used for the synthesis of collagen. So my main issue with all this peer review communication is not that the experiments are well designed. It's like they are taking, these good results, and they are basically saying, what you are taking is hydrolyzed collagen, and hence hydrolyzed collagen does this. No, you have a blend. When you have a blend, you cannot discard the effect of the other ingredients. So your product, your blend is doing something good. Don't put collagen as the hero, because you don't know if that is the hero. Okay, some other peer review communication, we have the same issue, basically we have this is low molecular weight collagen peptides. And we have vitamin C and fruit concentrate mix, which we don't know what it is, but in general, fruits tend to be rich in flavonoids and antioxidants, so it could have an effect. So in this case, like once again, we have a blend of ingredients that can produce the results. And basically, we are not sure of what is the actual, like contribution of the hydrolyzed collagen. These are part of the result. We saw an increase in moisture and as I say, a decrease in the crowfeet, basically visual grade. So they become less noticeable. And as I said before, like in this, like they basically make the study focuses in collagen, like, and saying, like collagen is what is doing this when you have a blend of ingredients. So they forgot to talk about vitamin C or fruit extract in the mix. So why is this so, like why people think that collagen can do so many stuff? And this is the reason why, like it's important to look at the scientific data. We know for sure by in vitro studies, ex vivo studies, and in animal studies that these peptides, these, hydrolyzed collagen peptides can produce a benefit. For example, in this paper, we can see that collagen peptide supplementation protects against UV-inducing epidermal thickening in mice. So this is some mice that were taking this collagen, basically, and they were, these are like basically collagen peptides, and we were like seeing, improvements on this. So there is some evidence for the use of collagen supplementation. So we have a lot of literature talking about what these peptides do. For example, the collagen peptide, the most famous one is proline and hydroproline. And this peptide basically at this concentration is able to increase fibroblast proliferation. So awesome, we will have more fibroblasts. And hence hyaluronic acid synthesis and activation of hyaluronic acid 2 transcription. So basically, hyaluronic acid synthase 2 is one of the enzymes that produce hyaluronic acid. And this kind of matches with my experience when I took those peptides. I took a collagen peptide and also took hydrolyzed collagen. I didn't see any difference between the two of them. But I noticed an improvement in my skin hydration. So maybe this is the mechanism. And it's also, like produce this peptide can, help you with the clear of damaged structure in your skin. There also are papers that say that these peptides are involved in wound healing. So by taking the supplementation, you can help the skin to repair fast, which makes total sense because the skin, repairs with collagen. You first have collagen 3, and later on you have to replace it by collagen 1. So you need an excess of these amino acids. So wound healing is one of the processes that could be, like accelerated by taking the supplementation. Collagen hydrolyzed peptide also decrease the expression of pro-inflammatory cytokines, so it helps you to control inflammation, which is also a good thing. We also know that when the ingestion of collagen hydrolyzed, as well as eating a diet rich in meat, so a lot of collagen, both of them increase the level of 12 different types of collagen peptides in circulation. So if you eat a steak or you take your hydrolyzed collagen, you will have basically the same effect. And right now, the carnivore diet is very popular, especially with people with immune compromised diseases, with diseases that basically work through an immune system that is not properly that is not functioning properly. So this could be, like something like, like you don't want to take the hydrolyzed collagen, increase the amount of meat in your diet. These are the type of peptides that were detected after both the hydrolyzed collagen ingestion or the eating of a meat rich in collagen diet. So you see the most abundant one is this proline hydroproline peptide. That is one of the ones that they use it the most with animal studies and with in vitro studies. So we have more, like information that say that plasma levels of this peptide, the proline and hydroproline peptide, go back to normal 24 hours after ingesting collagen. So it's mean that the peptide is being, sent to organs and basically, like it's being used. It's being, like it's not that continue going into circulation. No, it's being used. So good thing. And when you use radioactive peptides, so you can actually see where the peptide goes after that you eat, you can, this is experimental in rats, of course, you can see that skin fibroblasts, femur chondrocyte, and synovial cells have this peptide after 30 minutes. So very good indication that a hydrolyzed collagen peptide, either derived from your supplementation or your steak, they can go to the fibroblasts, and fibroblasts can produce basically collagen. So what do you think? What do we think about collagen supplementation? I think, as I say, I took them for a while, for over 6 months, and I saw an improvement in my skin hydration. I didn't see any improvement in firmness or elasticity in the body, but it was something very nice, I have to say. I switched to a diet rich in beef, in red meat, and I kept that hydration very nicely. So I think this collagen peptide works. I think most of the peer-reviewed communication based on supplements that are commercially available are not doing this subject a favor, because they are omitting the information that they have other supplements and putting all the weight on the benefits on collagen. And that creates, kind of like suspicious, basically, reaction, because you are not telling me all the truth. So I think there is data. I think this could be something. And the same effect that you can get from hydrolyzed collagen that tend to be in the highest price can be, obtained with collagen-derived peptides, because if you digest well, you will have them, or using, this diet rich in meat. So that is it. Those are my thoughts about collagen supplementation. And if you have any questions, you can find me on my Instagram, and you can send me an email.